Shoulder pain is a fairly common problem that many people experience, and it's often hard to figure out what's causing it. Shoulder pain can appear directly in the shoulder area or in both the shoulder and around the neck. This video describes common causes of shoulder pain, especially shoulder strains, rotator cuff injuries, and osteoarthritis. Simple shoulder strains are responsible for more shoulder pain than any other cause. Strains result from overuse or overexertion of the arms. Strains sometimes cause tendinitis or bursitis. Tendinitis is an inflammation in a cord that connects muscle to bone. Bursitis is inflammation in one of the small, fluid-filled sacs located in joints throughout the body. Other common causes of shoulder pain include the following. Rotator cuff injuries. The rotator cuff is a group of 4 tendons that control arm rotation and elevation. These muscles and their tendons work together and are largely responsible for the range of motion and strength in your shoulder. Rotator cuff injuries are common and become more likely as we get older, but they also happen earlier in people who have jobs that require repeatedly performing overhead motions. Examples include painters and carpenters. Rotator cuff injuries have ended the careers of many professional baseball pitchers. Rotator cuff injuries usually cause a dull ache deep in the shoulder that can make it hard to sleep. They also make it difficult to comb your hair or reach behind your back, and they're often accompanied by arm weakness. Shoulder osteoarthritis. Shoulder osteoarthritis, or OA, is also called degenerative joint disease. It happens when cartilage and other joint tissues in your shoulder gradually break down as friction in the joint increases. Pain grows more frequent and more intense as the shoulder slowly loses mobility and function. Shoulder OA affects approximately 1 in 3 people over the age of 60. Pain may cause stiffness, limit range of motion, and interfere with sleep. Some people report hearing and feeling grinding and clicking noises as they move a shoulder. Impingement. Shoulder impingement occurs when the top of the shoulder blade rubs against or impinges on the soft tissue in and around the rotator cuff. You typically feel impingement when you lift your arm away from your body. Impingement can lead to bursitis and tendinitis. Frozen shoulder. The bones, ligaments, and tendons that make up your shoulder joint are encased in a capsule of connective tissue. Frozen shoulder, or adhesive capsulitis, occurs when this capsule thickens and tightens around the shoulder joint. Frozen shoulder causes stiffness and pain. Doctors aren't sure of the cause, but it's more likely to occur in people who have diabetes or those who had to recently immobilize their shoulder for a long period, such as after surgery or an arm fracture. Fractures. Fractures, of course, are broken bones. Most often, a shoulder fracture involves the collarbone, upper arm bones, or a shoulder blade. It's often possible to prevent shoulder pain or injuries by doing stretching exercises to keep your muscles flexible and strong. But if you're experiencing shoulder pain, your best source of information and treatment, of course, is your doctor. To learn more about common causes of shoulder pain and how to get relief, click on the links in the description section for this video.